Good morning, everyone. I'm happy to be here. Egypt is a beautiful place and beautiful people. Thank you. We're going to talk today about diabetes. Diabetes is not just a concern. Previously, we thought diabetes was for wealthy people or a problem to confined high-income nations. But no, it's now becoming a widespread epidemic, impacting millions of people, immense strain on our healthcare system. Today, I'm here to shed light on the challenges we face, celebrate the strides we have made, and urge all of us to come together to fight diabetes. This is the statistics of the number of people living with diabetes we are expecting from 2021 to 2025. You could see that Africa has a big chunk of the burden of diabetes, and it's going to be worse with the days coming with our lifestyle changes. Currently, Africa is a home for 24 million individuals living with diabetes, and if we don't take action soon, the statistics will get to 55 million. Alarmingly, 60% of people living with diabetes remain undiagnosed, leading to late detection and severe complications. The fallout of this situation is severe preventable complications like blindness, kidney failure, amputations, and untimely deaths, which are seriously tearing families apart. Diabetes is more than a health issue. It's a socioeconomic crisis that threatens our development and places a significant economic strain on our household. Prevalence. Diabetes prevalence ranges from 2% to 6% across countries like Nigeria, Ghana, and Senegal. With a population of over 2 million people, Nigeria is estimated to have the highest people living with diabetes. However, less than 40% are diagnosed, access health care, and it remains limited, especially in rural areas. High out-of-pocket care for costs and limited access to medications and monitoring devices. As of 2024, over 24 million adults in Africa are living with diabetes, with Tanzania, Ethiopia, Kenya, and Uganda contributing. Challenges of late diagnosis are financial barriers, access to care, and healthcare system. When it comes to access, the major problem is education. We need people to educate people living with diabetes. Policymakers, NGOs, CSOs, public and private initiatives to enhance access. Logistics are a problem because management flow of resources to ensure equity. What we need to do best is to encourage countries to give waivers, subsidies, keep it simple, needle and syringe for everybody to be able to access diabetes care. Challenges in accessing care in Africa. We have limited healthcare infrastructure. There are less hospitals, less institutions, and then even the people to teach the clients are not there. And there is a very high cost of care in managing diabetes. For many families, the cost associated with buying insulin, monitoring glucose devices, checkups are just too high. We in Africa, we have stigma and lack of awareness. People don't welcome people living in diabetes. We don't help them. We stigmatize them. And then the healthcare is also fragmented. We have a vision that every person living with diabetes in Africa would have access to affordable quality care. Prevention of and early detection are prioritized to reduce the burden of diabetes. Governments, NGOs, and private sector must learn to work together to solve the diabetes problem. Our call to action is to strengthen healthcare systems, thus integrate diabetes care into our primary healthcare services, train healthcare workers to diagnose and manage diabetes effectively. We must invest in diabetes infrastructure and ensure access to medicines and technology. We should advocate for policies that reduce the cost of insulin and diabetes supplies. We must create public awareness, launch campaigns of prevention and educate communities, combat stigma. We need to have a lot of data and research in diabetes if we want to deal with diabetes properly. We should support research to develop context-specific solutions. Collaboration and partnerships are very important. We should work with governments, foster partnerships with international organizations and civil rights organizations. Thank you very much.